I'd like you to understand the different surgical options for lumbar herniated disc for the low back. To give you a little history in the neck, when you had a herniated disc a million years ago, we'd kind of go in the back of your neck and try to pull the disc out from around the nerve or spinal cord. But now we go from the front of the neck because the disc is in front of the spinal cord and nerves. It's much easier, right? Makes sense. But the low back is harder to get to through the front because of your stomach. But now we have such advanced techniques with our vascular surgeon team. We can get to through the stomach to the disc without cutting any organs or tissues or anything in 15 to 20 minutes and remove herniated degenerative discs that may be causing back and leg pain. And something even else that I think may be important is when you have a really large herniated disc that's pushing on the nerves into the back, why go in the back and pull already stretched nerves and cause more damage when you can go in the front and pull that herniation right out from where it came from without adding any extra stress to the nerves? I believe it might be better. It's something to think about. Take care.